Breast cancer is one of the most common cancer among women in Uganda and the developed world. According to statistics from hospital records, 44 of every 100,000 women have been diagnosed with cancer in Uganda.
And to anyone who does epidemiology, that is population studies, that is a very worrying trend. Why would a cancer multiply 4 times in almost one generation?
The disease is a silent but deadly enemy of humanity. To combat such an enemy requires one to apply the famous teaching of the ancient Chinese military strategist Sun Tzu, who said that if you make for the enemy's weak points, you may retire and be safe from pursuit. Much as breast cancer has become a menace to the Ugandan population, there has been very little comprehensive research on the disease, but that is slowly changing with the emergence of Thrive Consortium at the College of Health Sciences, Makerere University.
A normal cell has a lifespan. It lives and dies, and when it dies, it is replaced by another cell. So in a very, very orderly fashion. So one cell lives, and when it dies, another cell replaces it. Now, in a situation for a cancer, the cell that replaces the one that has gone away, they're not replaced in an orderly manner. Now, most of the cancer is in the ducts. It develops in those little tubes that bring the milk out. And the majority, we call it ductal carcinoma. It comes from those ducts. Now, a smaller percentage comes from the bulbs that actually produce the milk.
Professor Moses Galkande of the College of Health Sciences at Makerere University has been studying breast cancer for 10 years now.
So those cells kind of refuse to obey the rules of cell generation. So then you have a heap of cells replacing one, and when more cells develop, they need food, they attack other structures, and that's how cancer develops.
In 2012, he carried out a study on 700 women, which showed that 60% of Ugandan women suffering from cancer have the aggressive type,
compared to about maybe 20-25 in the West. And that explains perhaps why women in Uganda with breast cancer die faster than they should.
Most studies divide breast cancer into 4 subtypes. Understanding the different subtypes is important because they may need to be treated differently.
Now, the beta subtypes are given the anti-hormonal therapy that I talked about. Now, that anti-hormonal therapy is only useful for the beta subtypes. Now, we used to give every woman with breast cancer, anti-hormonal therapy. But now we've noticed that, we find from the study that it won't benefit 60% of the women. So what we are suggesting is, before you give this anti-hormonal therapy, please check what subtype the woman has.
The report also showed that after noticing symptoms, the women waited for over 2 years on average before they presented for specialized cancer treatment. 80% of women would report in the 3rd and 4th stage of their cancer.
On average, women waited for more than 12 months from the time they noticed a lump to the time they went for care. And there are different reasons why they didn't go. Either support from their spouses, or they thought it wasn't anything bad because it didn't pain.
Faith Chandiru is one of the patients who accessed treatment early and had her breast cut off before the cancer spread to other parts.
You know, I'm a chef. We are baking. You know, those bakings can give you a lot of chest. You feel pain. We thought it is the work. But when I came and said, this pain is too consistent. Let me go and see my doctor. So when I checked the doctor told me, there's some lump, you are developing some lump stamp here.
She says she was able to resume work at a hotel in Mukono.
So from there, they transferred me to stores.
I found her at the Uganda Cancer Institute in Mulago, complaining of side effects, which doctors say are not as bad as full-blown cancer. The research also looked at risk factors and found out that breastfeeding is a protective measure.
If a woman breastfeeds, then the cells inside the breast that would be vulnerable to, that would turn into cancer, are kind of given a break.
Breastfeeding is emphasized in order to boost the immunity of a child, but in this case it's not only beneficial to the child but the mother as well. I asked him whether there is any link between cancer and some family planning methods as some people claim.
Contraceptive pills may increase the risk of breast cancer in a select group of women, not all women. So a practitioner has to identify which women are at risk of a contraceptive method.
The research was meant to help improve policies in breast cancer treatment and care, and also encourage women to seek care at realizing first symptoms, which is most likely a lump in the breast.
So we are urging the powers that be to make some investment so that the standard of care for breast cancer in Uganda includes determining which subtype a woman has before treatment is engaged.
The report recommends that delays and late breast cancer presentation decreases survival rates among the affected women. There is therefore need to understand and address the drivers of late disease presentation and encourage women to demand for appropriate screening regularly. Irene Namialo, NTV.